Hey guys, this video is going to be about exercises and tests to help you determine whether you have a stiff shoulder or not, and if so, these exercises will help it out. So there's going to be 4 tests to help you determine what exercises that you need. So there is the functional external rotation test, the functional internal rotation test. There's a latissimus dorsi test to see whether your lats are stiff or not. And then last but not least, there's a test called the Tyler's test. So the first test is called the functional external rotation test. That test is simply whether you can take your shoulder and reach down behind your back. That's it. So you guys can see, you take this hand and then you reach down as far as you can go. So that's the test. And then you take your other hand to see what you can do. If it feels different, if one side feels more tighter than the other side, then it's almost safe to assume that that specific side that's harder to reach down is the side that requires more attention. So the functional external rotation test looks at flexion of the shoulder, abduction of the shoulder, and external rotation. You need all those 3 motions in order for you to take your hand and reach back down your spine. If the functional external rotation test is positive for you, meaning one side feels tighter than the other side, or there's a clear discrepancy between how far you reach down versus the other side, then the mobility drill that I have associated with this would be the one that you would do. So if your functional external rotation test is positive, this is the drill that you want to do. All you need is a power band, and you just loop it around something sturdy. I have a squat rack in the clinic, so I'm going to wrap it around here. Most of you guys probably don't have that. So usually what I do to implement this at home is you still need a power band. Take the power band, tie a knot. Okay? This knot will go on the other end of a door, and then you just throw it on the other end of a door, and then you just close the door. So then that way when you close the door, this band will lock it to stabilize it for you to do this drill. So I'll show you how this drill is done. So for me, I'm going to wrap this around here. You also need a stick like this, kind of like the one we were using for the lat. You use a broomstick. And you want to get this band pulling your shoulder forward. So meaning you want to apply the tension anterior to the shoulder joint. So you want to loop it in the back. So this band is pulling your shoulder joint forward. Grab the stick, get it behind your back, get it into the functional external rotation test position. So this is a self-mobilization technique. First things first is you want to get the band, the force forward on the shoulder, and that's maintained completely. And then you just take the stick and then you continue to mobilize it down, and with each time you bring it down a little bit further on the right hand. So this is you're using the left arm to do most of the work here, and the right arm is just holding the stick, bringing you more into functional external rotation. Usually I have people do this drill for a warm-up before they do their workout, 2 to 3 minutes, but 5 minutes max. Test number 2 is the functional internal rotation test. So the functional internal rotation test is you take your arm and you see how far up you can reach behind your back. And then you take your other hand and then you do the same thing, how high you can reach up your spine. If there's a discrepancy between the two, meaning one is higher than the other, then the one that is lower is the one that's tighter, and that is the one that is a positive on that side, which requires a mobility drill that I have that's associated with this test. The functional internal rotation test looks at extension of the shoulder, horizontal adduction, and internal rotation. You need all those 3 in order for you to reach behind your back. Any one that's lacking will result in a limitation in this motion. So the drill that's associated with this will work on all three of those. If you're positive on the functional internal rotation test, the drill is basically the same, but just backwards. So you still need a band. It's a little bit better if you have a long strap like this to do it. You can still do it with a stick if you have that, or if you don't have this. So the band is just backwards. So you take the band and you loop it again on the shoulder, but you want the force to pull it back. So once you have it all set up, once you have the band pushing backward on the shoulder, you want to maintain that tension. You just get the strap like this, throw it over your other shoulder, grab it from the back with the right side, and then all you're doing, maintaining pressure on the shoulder, is pulling it down, and your right one is just going for the ride, your left one is doing all the work. So the third test is the latissimus dorsi test. I just call this the lat test. And all you need is a stick that's like this, or you can use a broom at home, anything that resembles a stick where you can hold on to. So to do this test, you're basically testing to see how flexible is your lats and whether it is inhibiting your overhead reach or not. So you take this dowel, and the first thing you do is you grab it in a pronated grip like this. And you have your wrist, the starting position is about outside your kneecap. And then you lock your elbows and keep it straight. And you just bring this up all the way. Oh, the other thing is when you are sitting crisscross, you want your butt all the way back to the wall along with your back. So you want it to be flushed against the wall. So you take this and then you bring it up all the way. Typically people can do this unless you have really, really tight lats. So in this position, the lats are still in slack. It is not completely in the most taut position because the shoulder is internally rotated. You want to put it in the most taut position to test whether this is a positive test or not. So the next position for this is if you hold the dowel in a supinated grip like this, the wrist is a little bit outside your knees, and then you bring this back up again. And usually for people who are positive, they cannot get this up all the way, or in order for them to get it up, they have to really, really arch their back to get it up, or they just can't get it up at all. It just gets stuck somewhere around here. Versus if they put the lats in slack by doing a pronated grip, and then they bring this up all the way. So really the positive test is really whether there's a difference or not in a supinated grip versus a pronated grip. So if in a pronated grip, they can bring it up all the way, but in a supinated grip, they cannot, then that is a positive test for tissue tightness of the latissimus dorsi. If you have a positive latissimus dorsi test, then what you do is this drill. You need a little bit of weight on the stick that you have. This is a 3-pound weight, and all you do is you grab it in a supinated grip. The grip is a little bit outside of your legs, so probably about shoulder width, and you slowly bring this up. As you hit 90 degrees, you slow it down even more to achieve eccentric lengthening of your lats. So you still want the lats to contract, but slowly lengthening it as you're contracting. Once you get it up to the top, couple second holds. I usually let people go about 5, and then you bring it back down. And then you just repeat this about 10 times. So once you get it to about 90, you really slow it down to get the eccentric component of this exercise. So the lats can contract and lengthen at the same time. That's another way to help improve flexibility. 5-second holds here, and then you bring it back down. So the last test is called the Tyler test. So this test assesses whether you have tightness in the back of the shoulder blade. So most likely the posterior rotator cuff that's back here, or the posterior capsule, or any other soft tissue that's laying back here that limits your ability for you to bring your arm across your shoulder. So this is the Tyler test. This is kind of hard to do on your own, but you need to just be able to pin down your shoulder blade on the wall. So you want to be able to not completely lay on the shoulder, but you want to angle yourself a little bit so your shoulder blade is on the wall. So put weight on the shoulder blade, that way it's stabilizing it while you bring your arm across. So what you want to do is you're basically doing a cross body stretch, and the goal is to be able to get the elbow past the midline of your body, so really past the sternum. So if you can do this and just pass the midline, then that is a negative test. You don't have any soft tissue tightness in the back of the shoulder. And you also want to compare it to the other side as well to assess for symmetry. So you would do the same type of drill, same type of test to the other side, and if you can't get it past midline, then that would be a positive test. For the last drill, if you have a positive Tyler's test, this is the drill you want to do. You want to do eccentric lengthening to your posterior cuff or the posterior soft tissues of your shoulder. So again, you need a power band like this or some kind of tensioning band tied up to something tight and stable. You need to be on your side. So you get the arm out straight, and then you grab the band like this, and then you assist, this is just forehead rest, you assist it up. So you don't want it down here, you want it over here. So the exercise is you slowly bring the arm down, and then when you come up, you help it with the other hand. And then you slowly, eccentric external rotation is what you're shooting for. Here, and then you're slowly contracting the posterior cuff or the soft tissues in the back, but lengthening it at the same time. So that's how you improve, or one way to improve the soft tissue mobility in the back of the shoulder. Again, I usually have people do this about 10 times only, because this is, if your band is pretty tight, it's a pretty hard exercise. And you bring it slowly, just like that. And then the most important part when you're done with all these drills is you retest with all the things that you did initially to see whether there's an improvement or not. That's all I have for you guys. Give these a try. Let me know how it goes. Again, with these mobility drills for the shoulder, you're not pushing this to pain. These are all mobility exercises. You should be feeling tightness, maybe a little sore, maybe a little bit discomfort when you're pushing it to end range. So when you're doing these exercises, make sure it's not painful. That should not be the case. If that is the case, you want to hold off on those and check in with your local physical therapist prior to attempting some of these. Let me know if you have any questions, put them in the comment section below, and I'll see you guys in the next video. Thanks for watching.